what do you think about that in terms of the dosing, the frequency? Is there anything you can do alongside that to improve its efficacy, or is that just NAD plus and glutathione are two solid choices, sort of thing?
I'll answer the last bit first. So yes, they're solid choices. They're brilliant. And the reason I'm saying that is because they're not foreign to our body. They are what is designed to be in the body already. You look at random antioxidants that people come up with. Where do you find it in human physiology? You probably won't. There may be some benefit, but it's not in our human physiology. And that's why I personally prefer glutathione as the antioxidant of choice if needed. I don't believe there's a food requirement of antioxidants, but if you're going to use it therapeutically under medical supervision for a specific purpose for that individual, that's the one I'd go for. Now, in terms of if people don't know, it is basically reducing oxidative damage, which is going to be there if you have disease in general. I don't want to be too technical here. Now, in terms of how to go about using it, it is possible to use an IV. It is possible to use an IV push as well. And it is possible to microdose at home. Most people, I would not advise going for an IV or a push because, number one, there is no need for that vast quantity in one go. And again, there are issues with people that just jump to an IV to answer every question. However, if you microdose at home, and I think injection is the best way, because again, if you take it in a pill, how much of that actually is glutathione by the time it gets broken down in the stomach acid and the intestine? So if you bypass that and you microdose with an injection straight into the belly fat, like a type 1 diabetic injecting insulin, then you get, if you inject 50 milligrams, you got 50 milligrams. So it's much, much better that way. But there is also an issue of doing possibly too much. It's not common to see that. But I would possibly argue, Jonathan, your individual dosing of a couple 100 milligrams a couple times a week, that may be too much for most people. For you individually, if you're getting benefit and you're seeing positive changes, you should forget what I'm saying, because that's more important. What's actually happening inside you. And that's, to me, is suggestive that there's a lot of oxidative damage that is needing to be repaired. And so it's appropriate for you. However, as a matter of your safety, I would say to you, as long as you are feeling better and getting improvements, carry on. If you feel the amount you use versus the benefit you feel, if you feel that ratio is now dropping, it's suggestive that your bucket is now nearing its brim. And then you slowly taper down and go based on your symptoms. And this is what I call symptom tapering or symptom dictated dose tapering. Most people who do not have, and I know you've had some surgeries in the past, you got some back issues, so you would not represent the vast majority of the population. If we talk about the average person without having things like that in their past, and actually no symptoms, no complications, no problems, first of all, do you need glutathione? Okay. But second of all, if you do need it for some reason, whatever that may be, I would typically start with something along the lines of 40 to 50 milligrams per dose, and that dose something along the lines of 3 to 4 times per week. And then I would simply ask the patient, how do you feel? What's going on? Talk to me about your symptoms. And then we change the dosing protocol, or don't change, based on what they do as a result of that. When you restrict that dose to much, much lower, you're restricting the possibility of negative outcomes and negative side effects. And typically that doesn't happen because the patients I go down this road with have some level of oxidative damage already, like in your case. And so we don't have the negative outcomes. We just see how much improvement they get. And then once they're fine, we taper down. At that point, their diet and lifestyle has been corrected anyway. So they're not exactly going to have any more oxidative stress if they can help it because of the diet and lifestyle being corrected as well.
Thank you for that. Yeah, that's very well explained. It seems to be the same sort of approach that I'd use with, writing a diet plan for someone. Like, okay, where do we start? Where do we need to go? What small change do we need to introduce to get a certain effect? It's the same thing, but you're just looking at symptoms rather than a picture or a scale weight or something. Yes, it's a good take.
And I would say to patients, if you're seeing someone that is offering you this, either NAD plus or glutathione, and they just say this many milligrams, this many times a week, and that's it, my personal advice would be to walk away. It is not that simple. If they do not ask you, what are you eating? What are you doing in your life? Are you either not trying to find out about your diet and lifestyle, and they just give you a dose like that? I personally believe they're doing you a disservice, not necessarily on purpose, but because they haven't been educated on it. And I understand why they haven't, because this is not taught in medical school. It's not in universities. I've been through the system. It's not there anywhere. Even established doctors who have been around for decades and decades, that are twice my age, are in the audience when I'm teaching this. And it's new for them. And it's difficult for them to understand. So you need to go to someone who does have experience. I mean, if you're in London, I'm available, but there will be people all around to do this.
Interesting. If you've got any more time, I'd like to discuss
Sure.
a little bit about kind of a little bit about performance enhancing drugs, but more so in like the peptides realm.
Sure.
So we're looking at like body composition stuff. So things like mitochondrial inhibitors, I think they're called. Mitochondrial support, so MOTC, things like that. SLUPP332, you may have heard of. We can go into maybe SARMs as well. So, or cardarine. Cardarine is something I've used with good effect. So I was wondering what you sort of understood about those, and do you use those in practice for anyone that's like an athlete, someone exercises, for example? What do you find effective, or is there a problem with each of these as well, of course?
My problem with those peptides is we don't have long-term studies. And if we take, I think one of the ones you mentioned was BPC 157. If someone is going to use that, I typically say don't go for longer than a month, personally. Human trials are scarce. It's very difficult to know what's going to happen to them afterwards. That's if they insist on doing it, you know, and I don't insist they do it. Personally, my go-to support agents or improvement agents are the NAD plus and the glutathione, and there is something else as a nutraceutical. I rarely mention it because I'm not interested in selling it, but for the purpose of this conversation, I will mention it because that's what the topic is. We look at something called Amino Ther, amino like amino acid dash THER. This is it's not a peptide, but it's a collection of amino acids, but individual amino acids. I say not with the peptide bond to make them a protein or a peptide. Studies have been done on this particular product to show, ran you 2021, if you want the reference, to show that this is so powerful in mitochondrial function. It made cancer cells destroy themselves in the model, while the host cells became stronger. Same product did both at the same time, selectively. And this is because what do mitochondria respond to? It's not peptides, it's amino acids. They have nutrient sensing pathways. The sensing pathways for fatty acids and glucose are based mainly on glycolysis and beta oxidation to break them down. The sensing pathways for amino acids are very different. We can use amino acids to use as metabolic fuel. However, their main job is to create protein, which is structure and everything around us. We're depending on what paper you read, 17 to 18% protein. So the mitochondria senses these things and then determines what happens with the metabolic fuel, which is the glucose and fatty acids. Now, I'm skipping a lot here for anyone who's deeply into this, but I'm doing that because I don't want to go on for 6 hours. But the mitochondria will sense those based on the amino acids. And this is how this product works, this particular nutraceutical. When it does that, then it creates what we want it to create. And there are versions of this product used in mitochondria in different parts of the body, which I won't go into.